We're talking about thriving with diabetes. Thriving with diabetes. Diabetes is not usually associated with the word thriving. In fact, most people think of diabetes as this kind of languishing, this process where the diabetes has a mind of its own, if you will, and they seem to think that they don't have any control over their blood sugars. But we want to talk about how do we go about actually treating our blood sugars, treating our diabetes, and having a good life, if you will, and thrive with our diabetes. You've heard the statistics over the last several nights that there are 34.2 million people in the United States that have diabetes, 88 million who are pre-diabetics, and many of those, both diabetics and pre-diabetics, don't know that they have the disease. But I want to spend some time talking a little bit about the actual cost of diabetes. So if you look in this on this graphic in that lower portion, we're going to go ahead and blow that up. And there are $327 billion spent on an annual basis for medical costs in terms of actual costs and in terms of lost work. That is someone who presents because they need treatment for their diabetics or some related issue, or because they're having an issue, they can't go to work. So their employer is paying them for that time that they're off, or they have to hire someone temporarily to fill in for that person. That's $327 billion. The risk of early death is 60% higher for someone who has diabetes compared to the normal population. And the medical costs are 2 times that of someone who does not have diabetes. 1 in 3 adults, despite the fact that we are spending millions of dollars, billions of dollars in the treatment of diabetes, 1 in 3 adults with type 2 diabetes has an A1C, and that's the marker of whether you have good glycemic control, has an A1C greater than 9%. That's huge. So think about that. All of the money that's poured into diabetes management, and yet about 30% of people who have type 2 diabetes still are not at goal. Our goal, by the way, is less than 7. So, how do we diagnose diabetes? So, the main symptoms of diabetes are really polydipsia, so drinking a lot, polyphagia, where someone is eating a lot. They may be fatigued or lethargic, or they may have loss of their weight because their blood sugars are so high that the body is peeing out their calories. They may have blurred vision, or they may have, which is not on the screen here, but they may have cuts or bruises that don't heal well. So all those things are things that we see in our diabetics. And so the criteria for the diagnosis of diabetes, there are actually 4 of them. The fasting plasma glucose level, that is, what is your blood sugar in the morning when you wake up after you've been fasting, before you eat. There's also a 2-hour glucose tolerance, so you get um, the orange stuff, if you will, and you drink that, and they check your blood sugars after you've had that to drink. But one of the most common is the hemoglobin A1C, which you'll see down there at the bottom of the table. So a hemoglobin A1C of less than 5.7 is considered a normal hemoglobin A1C. 5.7 to 6.4 is considered pre-diabetic, and then a 6.5 or higher is considered diabetes. And so the test is done either by getting blood work, where they draw blood and you're at the lab, or in some cases, physicians in their offices may have devices or hemoglobin A1C machine that they can check that. So once again, if you're below 5.6, then you're in the normal range. 5.7 to 6.4 considered prediabetes, and then 6.5 and above, you are actually considered to be a diabetic. So once again, we talk about the symptoms, but here are some of the complications, right? So the most common cause of death in the United States is coronary artery disease. And the most common cause of coronary artery disease in the United States is diabetes. So hence diabetes is one of the leading causes of death. Nephropathy, so kidney problems, neuropathy, nerve damage. People can have stroke, they can have retinopathy, which is damage to the eyes, the vessels in the back of the eyes, and then peripheral vascular disease. These are all things that you see with diabetics. What are some of the risk factors? So, a family background. So, if someone in your family has diabetes, you're actually at a higher risk. Let me say it again. You're actually at a higher risk for having diabetes. If you're overweight or obese, physically inactive, anyone who's 45 years or older, certain ethnic backgrounds, and then someone who has high blood pressure, because that blood pressure and then the obesity, being overweight, all fit into this category that we call kind of a metabolic syndrome. Metabolic syndrome. So criteria for adults, and this is just a long list, but I do want to point out a couple, right? So if you, the number one, if you have a A1C or sorry, a BMI that's greater than 25, right? If you are physically inactive, as we talked about before, a first degree relative with diabetes, if you are in one of the ethnic groups where you have an increased risk, women who have had a baby greater than 9 pounds, then they, or someone who has gestational diabetes, those are people who also are at increased risk. High blood pressure, high cholesterol, A1C that's continuing to climb. These are all things. If you don't have any of these, but yet you're 45 years or older, then you should also be screened for diabetes and for prediabetes. So, what is actually the treatment for diabetes? So this is a little diagram that I came up with, and it used to be 7 things, but I've kind of compressed them into 4. So diet, activity, medication, and this group over here that I call the common pathway, and we'll get to that in a minute. So on the screen, you see a group of things. Can anyone, if you in the chat, just type in for me, which of these do you think are carbs? A, B, C, or D? Which group of foods on the screen do you think are carbs? And just go ahead and type that in. You know, A, we got some hamburgers, we got a muffin, fries, we've got a Snicker bar, I think, or a candy bar. We've got some candy on the table. In B, we've got, oh, these healthy vegetables. Look at that. One of my favorite vegetables, eggplant. We've got lettuce and cabbage. And then in the C, we've got all of our healthy fruits. And then, of course, juices that are in letter D, right? And so the fact is really that all of these are carbs, right? So carbs are in everything that you see on the screen. And if I had to define a carb, I would define a carbohydrate as anything that really grows from the ground or anything that is made from anything that's grown from the ground. So that's why rice and potatoes are carbs because they come from the ground. Pasta, which comes from wheat, rice, which comes from the ground also. So those are all carbs. And there's been this kind of battle between good carbs and bad carbs. And people ask me all the time, Dr. Woode, you know, should I, and I'll take an example off of the screen, you know, should I eat a hamburger or can I eat an apple? Should I, you know, can I eat pizza? Can I eat? And so they go through all these rigmaroles. And I say to them, really what we need to talk about is not whether you're eating a French fry or an apple, right? But the fact that at night you eat a gallon of ice cream. So it's not the apple that's causing the problem, or the French fryer for that matter, right? So there may be other issues that are going on. So the diet, and we tell people that they should limit the amount of carbs. And a magic number that I give is about 45 grams of carbs per meal for our diabetics. There's no magic in the number itself, other than we are limiting the amount of carbs, right? So we could just as well say 60 carbs or 70 carbs or 100 carbs. But as we get higher in the carbohydrate content of the meal, it is more difficult to manage the blood sugar. So, as convention, we say 45 grams of carbs. Exercise, right? So exercise is humongous in the management of blood sugars. Now, exercise, when I say that, a lot of people envision that I mean that they should be at the gym, they should be spending lots of money to go do these spin classes. What I mean when I say exercise is really moving a muscle. Anytime you are moving a muscle, you are exercising. As you use muscles, the muscles burn sugar. And as the sugar is burned, the blood sugar goes down. And so the more muscles you can use, the more often you can use muscles, the lower the blood sugars. Hence, if all you can do is you move a pinky, right? Because something else is going on, that's your exercise. But the more you do, the more the blood sugar goes down. So going out and walking, running, jogging, getting on a treadmill, all those things are excellent because they help to burn blood sugars as well. Medications. Now, there are a lot of people who are adverse, who not adverse, but they don't like medication. Let me say it that way. And that's understandable. No one wants to take medications if they don't have to. But there are occasions where the blood sugars are so high that we do have to use medication. Now, you are in total control on how much medication you have to take. This is geared towards the type 2 diabetics because, as you know, in type 1 diabetes, they require insulin. So they've got to take that medication. But in our type 2 diabetics, most of the time, we're able to manage the amount of medications that we're on. Now, just a comment about medications. If your blood sugars are high, and when I say high, I'm talking 300, 400, 500, and sometimes, as we see in our practice, 600 blood sugars, or as I see in the hospital, even more than that, then there is really not a good way to immediately get that blood sugar down without medication, right? That's just a fact. Do you have to stay on medication long term? The answer is probably not. Because if you're doing the things that we just talked about, managing your diet, and when I say diet, the amount of food, the types of food you're eating, not necessarily a specific diet, managing your diet, if you are exercising, then those things will bring blood sugars down. And as the blood sugars are decreasing, then you are able to decrease the amount of medication that you are on. Okay. And then finally, this group of things that I talk about, sleep is one of them. And I call that the common pathway, right? The common pathway. And the common pathway says that anytime there are stress hormones in the body, then those hormones will raise your blood sugar. So let's take a look at some of the things that can cause hormones to increase. So stress, right? So we live right now in a stressful environment. We've got COVID that's there, the COVID pandemic. We've got social unrest. We've got election issues that are going on, right? People have lost their jobs. They're not sure where their next meal is coming from. If you look on television, you'll see car lines for people who are trying to get food. So that's a stressful environment. You may not be a person who sits down and worries or stresses, but your body is in this environment and there's this kind of just a natural baseline stress that's going on. That causes blood sugars to go up. If you're not getting enough sleep, then the body tries to keep you awake the next day by pumping you full of adrenaline and the blood sugars go up. Anxiety, if you're in pain, that causes stress to the body. Depression, or even if you have an illness, right? If you've been in the hospital, if you're at home, you've got a cold, you've got an infection, you're on antibiotics, you're taking cold medicines, all of those things can cause blood sugars to go up. So as you see, it's not always food. It's not always exercise, and it's not always medication. So if you are eating well, if you are exercising, if you're taking your medication, and those blood sugars are still high, then we've got to look to see, okay, what else is going on in your life? I've had patients who come in and we're talking about their blood sugars, which are uncontrolled. And we stop and say, wait a minute, what else is going on? And someone will say, oh, mom is in the hospital. She's sick. So I've been driving back and forth to take care of her. Or I'm going through a divorce. Or I've got a child who is ill. Or that. So all these different things cause stress in the body. They cause hormones to go up. And those eventually lead to high blood sugars. So how do we manage that? So we recommend that you get at least 7 hours of sleep each night. Learn how to relax, learn how to sleep. Don't go to bed with the TV on and talking on the phone and watching something on YouTube and reading a book, right? So when you get into bed, the light should be off, it should be dark. You should lay in the bed and you should go to sleep. If you have trouble going to sleep when you've done all those things, get up, get out of the bed, go sit in a chair if you want to read, if you want to watch television. But the bed should be only for sleeping. So get in the bed when you feel sleepy. Stress. You've heard, we've talked about some of the folks in our area that help to manage stress. Dr. Williamson talked about the stress that causes high blood sugar when she talked a few nights ago. So finding ways to do that, whether it's meditation, whether it's finding a hobby, exercising is a great way to manage stress as well. Depression and anxiety, right? So depression and anxiety, worrying about something that is coming in the future that you don't have control over, right? Or being depressed of something that happened in the past. Those are things that you may need to sit and talk with someone about. You may need to find someone in your church, a pastor, a friend, a counselor that helps to deal with all of those. And certainly, if you're in pain, we've got to find someone to help you manage the pain, because if not, then those blood sugars continue to rise. And then there are some things that are out there that we have known about that can affect blood sugars. So things like cinnamon, right? These are some of the alternative things that you may find. Bitter melon is that green, not fruit or vegetable, if you will, that you see in the upper right hand corner. And then all the foods that you see in the lower right hand corner are foods that have chromium. And then in your lower left corner, you see turmeric, which is good for joint and muscle aches and so forth. So there are a lot of things that are available that can help with blood sugars. And finally, I want to say a couple of things. One, remember that you have control over your blood sugars. The things that you do, the food that you eat, the exercise, medications that you take, right? All of those can affect blood sugars, but also that common pathway group of things, sleeping well, getting getting enough sleep, dealing with anxiety, dealing with depression, right? So all of those things will help to manage blood sugars. So thank you for listening. I hope that you've gotten some good tips, some good ideas, and I think it's time for us to get to take some questions now.
Yes, thank you, Dr. Wood, for that informative presentation. Um, as we're waiting on some questions to come up, let's just talk about some of my takeaways. Um, I like to take notes, so let's see what I wrote down. So I thought that your comment about the common pathway, that was something new, or some new information that many people may not understand or may not appreciate as much. Also, the fact that a carb is anything that grows out of the ground. Sometimes we think of carbs as rice or potatoes or pasta or bread. We don't think of vegetables as containing carbohydrates. And we're not making a judgment on whether it's a good carb or a bad carb, but just being able to identify what a carbohydrate is. So that was helpful to me. Now, if I were to pose a question, I would ask, how much exercise should an individual get on a daily basis if they are using that as a strategy to help manage their diabetes? How would you respond to that?
Oh, that's a wonderful question. And our current recommendation is that people get at least 30 minutes of exercise per day. And the current recommendation is actually that it be done for 7 days. Now, one point is that it doesn't have to be all at the same time. So cumulative exercise is good as well. So if you can do 15 minutes here, 10 minutes there, all of those are good things. Um, the other point that I want to make there is that exercise is a wonderful way to treat blood sugars immediately. What does that mean? So that means that if let's assume that I ate breakfast and I check my blood sugars a couple hours later or before lunch and that blood sugar is elevated, I can exercise at that moment to bring that blood sugar down. Often we think that, oh, well, I exercise 2 or 3 times a week and that's good and that is great. But if I want to treat this blood sugar at this moment without, by the way, taking medication, right, then I can go exercise right now and that will bring the blood sugar down.
Okay, good, 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 good. So, um, have a question now. Can the frequent thirst, urination, and hunger be attributed to something else? Does it have to mean that you're diabetic if you're experiencing those symptoms?
No, there are actually good question. There are other illnesses, if you will, that can cause someone to be um, to urinate or to be hungry. So it does not have to be diabetes, but of the things that we think about and the most common things, then diabetes is right up there on that list.
Okay, okay, great, great. For type 1 diabetics, are there really any supplements that help control blood sugars?
Oh, wonderful question. And the answer is yes. Remember that in type 1 diabetes, the body does not have insulin, right? And so insulin is required. But once you take insulin, insulin brings blood sugars into the cell. So if a type 1 diabetic is taking insulin and they take supplements that can sensitize the body to the amount of insulin they're taking, then potentially they can actually take less insulin. So it's not a matter of being totally free from insulin, but the body can use the insulin more efficiently.
Okay, okay, good, good, good. So, how can I handle my pain or how can I treat my pain without using prescription pain medication?
Oh, very
Another
good
question.
question. There are a lot of things that are out there that purport to handle pain. One of the things that we pointed out on the screen was the turmeric. So a lot of people who have joint aches and joint pains, muscle aches and muscle pains can use turmeric. That will help. There is a growing thought that CBD or cannabidiol is a good way to manage pain. And in fact, as we look around the country, wherever they've had CBD use, they've seen that the amount of opioid medications that are taken has actually decreased.
Dr. Wood, do you have any personal experience with any of those that you mentioned?
Yes, I actually several years ago was suffering from body aches, body pains, neuropathic pain, and so I've used CBD myself to a tremendous benefit for myself. I was able to actually decrease and or and come off of some of the pain medicines I was taking.
Okay, okay, good, good, good. Um, there was another question, but it's disappeared now. Okay, what supplements?
And I'm assuming these are supplements for the management of diabetes.
Yes, yeah. You
Okay.
were talking about even the type 1 diabetic, what supplements could they take? And you mentioned insulin sensitizers.
Right. So insulin sensitizers would be things like cinnamon, which has been shown to decrease or sensitize the body to insulin. Bitter melon, another one that was up on the screen. The chromium that we talked about earlier. So those are all supplements, and there are some supplements that have a combination of those. So that would be those would be good things to do.
And earlier in the week, one of our guests won a bottle of Captivita, which is a supplement that combines bitter melon, turmeric, or curcumin. It's hard to say
Curcumin,
that
right?
word. Cinnamon, chromium, and there's some other ingredients in there as well. Aloe, bay leaf, ginseng. Um, what are your thoughts on the Captivita for a person with type 1 diabetes?
Yeah, so always I start by saying that type 1 diabetics, remember, type 1 diabetics need insulin. So as we talk about supplementation, we're never talking about a supplement that decreases or gets rid of the need for insulin. So insulin is always there. But once again, the sensitizers are great. So Captivita, with a combination of those different components, cinnamon, bitter melon, curcumin, those are great. One thing that I caution the type 1 diabetics about, though, is that remember that insulin is the requirement. And so we don't want to decrease the blood sugar to the point where you are taking away too much insulin. And that's something that should be done with the direction and assistance of a physician.